project involved a former client, a critical access hospital located in the Midwest. It was serving a very small community, and the CNO actually reached out to us and asked us to help her find an interim leader for their perioperative department. Because of that volume, it was a small volume amount, but the hospital and that perioperative service line was essential to the community that they served to ensure access to care in such a small area. Since the CNO already knew HealthLinx and she was already familiar with our process and outcomes, she engaged us to provide an interim leader for the perioperative department. Initially, it was a 17-week project, and as that period came to a close, we realized that the organization would still need additional support. The original interim leader had a previous commitment and couldn't extend, but because of HealthLinx's deep bank of experienced professionals, we were able to quickly place a successor and ensure a seamless transition without losing momentum in the project. The perioperative department had a combination of long tenured and newer team members, but the environment had become unstable due to ineffective prior leadership. The CNO needed an interim leader who could quickly assess the department, rebuild the culture, and reinforce accountability and consistency in the department. The first interim leader was highly effective in doing just that. She stabilized the department. She quickly built relationships, not just with the staff, but with the surgeons, providing care in the department, as well as other team members in the organization. She engaged the staff in rebuilding the culture, creating a culture of safety. She observed daily practice, reviewed policies, and ensured that evidence-based standards were not only documented, but actually lived out in the department. Her collaborative, inclusive approach helped reestablish expectations within the department, reestablish accountability and trust. Again, not with just the staff, but also with her physician colleagues and the administration. The second interim leader brought very different and perfectly timed skill set. He continued the stability, reinforcing the culture in the department, but he also had deep experience in perioperative renovations, equipment planning, and vendor partnerships. And as the hospital prepared to navigate renovation of the surgical space, he guided decision making and contract negotiations during this time. Probably the most important success in this project would be the organization had had difficulty in recruiting to the position, mainly due to the remote area of the hospital. The second interim leader identified a high potential internal candidate and developed an onboarding and competency plan specific for her using AONL standards and mentored her for more than 6 months, ultimately preparing her to step into the permanent role of director in the department. Together, both interim leaders created meaningful, sustainable change. The department regained structure, accountability, implemented evidence-based practices. The surgeons' relationships strengthened, communication improved, and their culture stabilized. The organization successfully navigated a perioperative renovation with the right equipment and vendor partnerships, and ultimately developed and onboarded their own permanent director. The result wasn't just short-term, it was long-term department stability and leadership continuity.